The School of Medicine in the North East provides a wide range of opportunities for training, both in the GIM related specialties but also in smaller specialties such as rheumatology, clinical neurophysiology. We're very fortunate to be in a region that consistently gets very good feedback from the trainees and from the GMC NTS survey, and I think that's down to the fact that the trainers in the region are exceptionally engaged with training, and we're all very keen to develop training programmes that deliver what trainees need and want.
I think what we have are really enthusiastic supervisors and educational supervisors and consultant colleagues that genuinely support trainees as they move through the programme, such that they get good training and they're ready for consultant posts by the time they exit the programme. And hopefully many of them will stay in the North East because of that.
We have a very strong academic training programme, starting at foundation level and going all the way through to completion of training. As well as strong academic opportunities to go out of programme, we have very good conversion rates for trainees in academic training programmes who then move on to complete higher degrees.
We offer 2 protected 4-month slots for academic work during the 2 years of the foundation programme. We also offer a very trainee-centred approach. What's really important is the close working between Newcastle University, our local NHS trusts and Health Education England North East in delivering a very integrated clinical academic training experience for our trainees.
We have a very clear vision and support from our postgraduate dean, Professor Kumar, who feels that strong clinical leadership is the key to delivering the education that the trainees need.
For the CMT trainees, we've worked in collaboration with the Royal College of Physicians Northern Office to provide a practical skills training course which addresses all the practical skills that they need to complete for their first year of training. We're leading the way in many areas across the region, including examples where training programmes have started new innovative ideas. Gastroenterology runs a sprint training programme for their new trainees. Respiratory has developed a passport to bronchoscopy, again for their new trainees. We are very proud of the fact that our geriatrics training programme has developed a Geriatrics for Juniors training day, which is attended by trainees from all over the UK.
One of the reasons I love geriatric medicine up in the North East is that there's a lot of opportunity to do different things. So I've had loads of experience in old age psychiatry, in community psychiatry and community palliative care. I just think there's such a wide range of things that we can contribute to, and we've got a really up and coming system here that is interested in community geriatrics, which is obviously at the forefront of everyone's mind in the country at the moment.
Our cardiology training programme is one of the top ranking training programmes in cardiology in the UK. We have examples around the region in the Newcastle hospitals and the South Tees hospitals where they have dedicated cardiology angiography suites where they train the trainees. Simulation is taking an increasingly important role in medical education. As a region, we have a very strong basis of simulation training, with many of the different trusts having simulation suites.
Simulation facilities we've invested in because we know how useful they are to train. It's a very safe environment for people to train in. It's a very safe environment to make mistakes. And they're the realest that we can get before people meet patients. And we hope that that means that when they do meet patients, they're that bit better, that bit safer, that bit more confident.
We must also mention our Faculty of Patient Safety, which was set up in 2015 and has been recognised by the GMC as an area of good practice. This group brings together our human factors training, our simulation training, our technology enhanced learning, and how we learn from critical incidents across the region. The group pulls together experiences and knowledge, and uses all of the simulation facilities from the region to deliver excellent training events, establishing a great network of individuals who are keen always to work together, and we offer a great deal of training in all of these areas, which we think really enhances how our patients are cared for in the region.
Currently we have 3 educational training and leadership fellows who are currently working with us to develop training opportunities across the region, but also as part of their personal development they are developing their own skills in leadership.
There's a lot of talk about junior doctors and trainees being the leaders of tomorrow and having an important role to play in the future of the NHS. And this scheme really puts that into practice, so we're getting sort of experiential learning through spending time with chief executives, learning about leadership theory, and also developing leadership skills during doing projects throughout the region. And I think sort of learning on the job or learning in practice is very important and a very effective way of learning leadership skills.
Often when people do train here, they stay in the region, and we have a number of training programme directors who've been here since core training, have trained all the way through and are now leading our training programmes.
I moved up here from Manchester, which was where I grew up, and I just fell in love with the region. The lifestyle up here is amazing. You have great cities, you have access to the countryside and the coast, but on top of that, it's ranked as the best place to train in the country. And how do you beat that combination?
I think in addition to a really well-structured programme, you're surrounded by great people, whether it's the nurses you're working with, your colleagues, or the patients that you're looking after. I think this area is just a great place to work.
The best thing about training in the North East is how friendly and supportive it all is. There's a really good network of supervisors, clinical supervisors, educational supervisors and training programme directors to help you if you've got any problems, and everybody that you work with on a day-to-day basis is friendly and keen to help train you.
The North East is a fantastic place to live and work, but above that we're committed to providing excellent training facilities, because we appreciate that we are nurturing and developing the trainees who are going to be our academic, clinical and educational leaders of the future.